Reports of concern about at-risk children made to Oranga Tamariki have surged by 35% in the past year, reaching over 95,000 cases. OT is still analysing the reasons behind this increase, with spokesperson Rachel Leota pointing to factors such as more family harm reports from police, increased engagement from schools, and a rise in concerns raised by whānau. While not all reports require intervention, the agency has noted a rise in cases needing urgent responses, but has yet to determine the cause. Community service providers argue that the spike is not just due to increased reporting, but also reflects deeper issues affecting families. David Hanna from Wesley Community Action says financial struggles, housing instability and limited healthcare access are creating significant stress. Whereas Tipu Eria highlights the previous downward trend in reports as proof that early intervention services were working. However, with recent funding cuts, many whānau are struggling to get the support they need, increasing the likelihood of crisis situations. Oranga Tamariki has invested $500 million into community support services, but questions remain about whether funding reductions in early intervention have contributed to the rise. Children's Minister Karen Chhour has paused a review of provider contractors to prevent further uncertainty, and she joins me now. Karen, a very good afternoon to you.
Good afternoon, Leah.
Nice to talk. Karen, at 95,000 cases, I mean, it is a big number of reports of concern about at-risk children in the past year. What are your thoughts on why these numbers are climbing?
So when I first came into this role, it was very clear that a lot of government agencies weren't working as collaboratively as they could be when talking to each other around families and families of concern. So my big focus was making sure that every agency that has a role to play when it comes to the safety of our children actually get together and work better together and communicate better. And this just shows in some of those areas reports of concern have come up from police, from education, from healthcare and from other agencies where we're working more collaboratively together, which is a positive because then we can actually get our eyes and sight these young people to make sure that they are safe. You've also got to remember that reports of concern are where we get our first touch point when it comes to a young person, and many of them don't require further action from Oranga Tamariki. This is when we can get the wraparound services in front of these families before the situation gets worse. Often it is the first sign that there is an issue within that household.
Okay, so you're saying, yeah, it's a high number, but it could be the very first time they've contacted OT and it wasn't initially, it couldn't have been, it may not have been a crisis situation. Is that what you're saying?
Yes, not all reports of concern are crisis situations.
Sure.
People may ring up where they have a little bit of a concern around something that might be going on in a home, and often we find that it might be an issue that we can wrap around a service so that it doesn't become a bigger issue. Prevention is really important. Oranga Tamariki has not changed the amount of spending that they're spending in the prevention space. We spent $500 million last year, $500 million this year in this space. We just may have moved where those services might be getting provided as we assessed contracts to make sure that we have them in the right place and that they're actually producing outcomes for our young people. I'm actually pleased to see that the reports of concern are rising. What concerned me was around COVID. Those reports of concerns dropped. There were less contact points for children to have eyes and ears on them when they weren't at school. They weren't going to doctors. They weren't being cited. Now we actually have agencies that feel confident enough to speak up, to let Oranga Tamariki know there may be a concern so that we can step in and put those services in place before it gets worse.
Karen, there's still a lot of talk about the impact of funding cuts to early intervention services. Do you think these cuts could have influenced the situation?
I just have to be really clear, there haven't been cuts. We're spending exactly the same amount of money last year that we spent this year.
But
What
moving
we've
it
done
around.
is we've assessed and moved it around to where we know that their sort of crisis points are. And this is why it's better to work collaboratively with agencies, because we can see the data and we can see where these services are needed the most. We've been working really hard in that collaboration space. Oranga Tamariki's relationships between agencies is getting better, and the better that gets, the better the data gets, and we can actually put the services in the right place.
Some argue too there's a lack of trust in Oranga Tamariki's ability to manage the situation, Karen. How do you think the agency can rebuild any trust that's been lost?
I think we also have to have an understanding that this is not just an Oranga Tamariki problem. So Oranga Tamariki is the last resort. They're at the other end of the phone when things have gone wrong. So we often get a phone call when things have gone very, very wrong. We may never have heard from these families before, or this may be a crisis point which has enabled somebody to ring us. Oranga Tamariki needs to get back to their core focus, which is what I have been trying to do over the last year, is care and protection of our young people and looking after those that are in the care of Oranga Tamariki and that come to the attention of Oranga Tamariki. It's not just Oranga Tamariki. We have many other agencies that have a role to play, but also as a society we have a role to play. And when you see something, say something. And I've been going around the country since I've been minister and saying to my staff and to community organisations that we need to work better together. When we see something, say something. When those reports go up, it shows me that there's more faith in the organisation because people are ringing and people are expressing their concerns so we can step in.
Karen, that's interesting. Can I ask a little bit more about this see something, say something? You said you've been travelling around the country. And are we talking, I mean, I know there's always been within whānau, there's always been, well, not always been, and they don't all do it, but there's a lockdown, right? Nobody says anything.
Yep.
So are you talking about within, or are you talking even people outside of the family?